Welcome to the election process for the 2021-2022 APHA-ASP National Executive Committee. To challenge the national officer candidates' ability to think on their feet, the current APHA-ASP National Executive Committee has developed 3 predetermined thought questions for each of the candidates to answer. You will now hear from Brooke Kulusich, candidate for Speaker of the House from the University of Pittsburgh. Brooke, your first question is, what is one unique aspect of APHA-ASP as an organization, and how would you promote the utilization of this aspect to non-member student pharmacists?
Absolutely. Well, I can just think back to my personal experience with APHA-ASP. When I was a first-year student pharmacist, what originally drew me to the association was that it's the organization for all student pharmacists. The diversity that this organization stands for is something that's very attractive to me, and I'm sure a lot of other student members. And that's, anything from hospital pharmacists to research pharmacists, community pharmacists, association management, you name it. So it really does appeal to a broad audience of students, and I think that is why our organization is truly so successful. It's because it takes those unique backgrounds and those unique perspectives that our students from various backgrounds bring, and that is truly where progress is made.
Thank you, Brooke. Your second question is, in your opinion, what do you think is the most pressing issue facing healthcare today, and what can we do as a profession to address it?
Absolutely. I think what it all really boils down to is just getting the word out about the services that our pharmacists are providing to the community. I mean, we've seen in the last year the way that our pharmacists have stepped up to serve our patients on the front lines throughout this COVID pandemic. So I think you see provider status state by state, just those efforts, those long-term efforts of years in the making of the vital reform that our profession needs, and for pharmacists to be acknowledged as providers for the services that we are providing. So I think that that's just going to continue to be the focus for our profession going forward. And I think this COVID-19 pandemic, while it has presented a number of challenges for our pharmacists, it has presented an incredible opportunity for us to demonstrate our value, not only to our patients, but to payers and to policymakers.
Thank you. Your final question is, how do you think the current pandemic will affect the scope of practice of pharmacy moving forward, and what opportunities would you advocate for to move pharmacy forward?
Absolutely. And like I said before, this pandemic, while it has presented a huge challenge for everyone, and especially pharmacists too, the opportunity that we have been given is something that we needed to seize, and we truly have. And it has added this increased urgency, for some of these the bureaucracy and some of the legislative barriers that have held up progress in our profession for so long. That those barriers have been broken down because we need to increase access to pharmacist services to the patients in our communities. So, I mean, we're seeing expansion of immunization rights for pharmacists. I mean, even in my state of Pennsylvania, the emergency waiver to allow student pharmacists, supervised pharmacy interns to immunize, that has been a long time coming, and a point of advocacy for our state. And it has been really rewarding to see kind of the fruits of that labor and the advocacy for it, which has been a long time coming, and how we have been able to participate in that COVID vaccine response. So immunizations are just one example of the many ways that pharmacists are stepping up, and they're ready to help, and they're accessible to our patients and our communities. And I hope that, if anything, this pandemic has brought that to the forefront for all to see. So.
Thank you, candidate Kulusich. This concludes the interview portion of the election process.